Breast augmentation surgery, that means is the patient wants the bigger breast than her breast. The patient's breast is generally small. That means the patient's breast is not harmony her body. And we are using implants for breast augmentation. Breast augmentation surgery can be performed under general anesthesia. For general anesthesia, the patient has not any health disease. If very serious health disease, we cannot give general anesthesia. Before the operation, anesthetic doctor control the patient. If the anesthetic doctor says, no, there is a problem, we cannot do this operation. And the second very important point is breast health. The breast must haven't any serious problem, any serious mass or any serious disease. Before the operation, we are doing control breast with ultrasonography or MRI. Breast augmentation surgery can be performed under general anesthesia. First step in the operation, we are using incision. Incision site, periareolar area or submammary sulcus. This incision site can be decided with patients before the operation. If the patient says, I don't want any scar, we are using periareolar area. If the patient says, the scar is not important for me, we are using submammary sulcus incision. After incision, we are doing dissection. So we are insert the prosthesis. These are silicone prostheses, and we are input the prosthesis and we are shoot the line. So our operation finished. We are using dressing and the patient put on the surgical bra. This operation is nearly 1 hour and maybe less than 1 hour. The patient must have only 1 night in the hospital after the breast augmentation surgery because the operation is very little time and the patient can healing very fastly. After breast augmentation surgery, the patient will have final result is nearly 3 months later. But after the operation, 3 days, the patient have a lethal patient. The patient must use painkiller and antibiotic. After 3 days, the patients generally have not any pain, but the breast must be very hard. Nearly 3 weeks later, the breast will be soft, but last or finally result will be nearly 3 months later. Today we are using breast augmentation silicone prostheses. These are gold standard for us. Breast prostheses have some type like this. This is a micro texture. This is smooth. This is texture. Nowadays, we are using generally smooth or micro texture surfaces. And the shape is, this is circular and this is anatomic. Upper side is thin, lower side is thick. That means anatomic prosthesis. We are using breast augmentation with fat grafting, but fat graft is with prosthesis is the best result because fat tissue is very soft, not very hard tissue. And if the breast is very small, these patients are generally very thin person. We have not too much fat grafting. That means we cannot use for breast augmentation because we have not enough the fat grafting. Generally, we are using prosthesis and fat grafting together. We are insert prosthesis and peripheral area. We are using fat grafting. This both of two material we have best result. After the breast augmentation, the patient can give her baby milk. That means breastfeeding is not problem because we are insert the prosthesis under the breast tissue, under the gland tissue. We are not touching the gland because we are putting under muscle area or on superficial area so that the milk can produce after this operation. These protheses cannot be ruptured spontaneously. These are very strong tissue, but these are human produced. That means the patient must be controlled every year, once a year. The patient can be used prostheses during her life, but during the life, the patient's body can be changed, especially breast can be changed because of the weight loss or hormonal change. If the patient have not any problem because of the patient's breast shape, no problem. But if the breast shape is not good, the prostheses can be changed.